How do we start this?
Action.
Welcome back to another podcast episode. This is episode 47. We have a topic today discussing whether or not EMS should require degrees. NAEMT stated that they believe their main concern is that having degrees in EMS would worsen the shortage that we already have. So we're kind of just here to talk about whether we agree or disagree with that and kind of highlight our points as to what our stance is.
Yeah.
Yeah, so what do you think, Ellie?
I think at the beginning it would worsen the shortage just because I think one reason people get into EMS is because it's a little bit of a shorter
Program?
Yeah, shorter program. Right. You can get to working faster. But I think as time goes on and it becomes the new normal and people know the benefits of the degree, I think that it'll go back to normal or even make it even better.
Right, and I think with a degree, you have to not only do the classes for the degree, but you have to do general studies classes along with it. And I think that kind of along with the shortness of the program, that people enjoy going to EMT school because you don't have the general studies classes. You kind of just go straight into what you're looking for. But I think there could definitely be some positives of having a degree.
Yeah, I agree with that.
Right, so I think initially I'm on the same page as you with I disagree that it would worsen the shortage. I think in the beginning it could definitely have a little bit of an impact on it. But like you said, I think once we kind of establish the benefits of it and one thing leads to another, it would increase everything.
Yeah, people don't like change, so it'll just take a little while.
Right. So do you want to talk about kind of what it would take for a degree for EMS?
So when I was doing some research, a lot of schools that have the general studies for an associate's degree, it's around 15 to 17 extra credit hours. So also looked into Oregon and Kansas because they actually have an associate's degree program right now.
Okay.
And so they only require one more semester. And they're probably pretty full semesters because I think full-time is 12 hours a semester. Okay. And so with the credit hours being an extra 15 to 17, it'd be a pretty full semester. But yeah, they do it in 2 years, 4 semesters.
Wow. And Australia has one too, right?
So they do a bachelor's degree.
Oh, wow.
But they don't do general studies.
So they just strictly do an EMT or paramedic program that leads right into it. Okay.
Why do you disagree that a degree would worsen the shortage?
So I think if we got degrees in EMS, that a lot of the schooling that we would do wouldn't necessarily be skill oriented as EMT school is now. I know a lot of it is lecture and learning the anatomy behind things, but a big part of it is doing skills. I think if we went for degrees and we took, anatomy and physiology classes, biology classes, stuff like that, that we would have more of a deeper understanding as to why the body works in the way that it does. And I think that higher education could also lead to greater advances in career opportunities and stuff like that.
Yeah, and that brings up something I was thinking about because they brought up in the webinar community paramedics. And so they're thinking about making that a master's degree.
Oh, wow.
Yeah, so they're just doing associates to make it a pathway for paramedic to eventually become a bachelor's degree. Okay. And then community paramedic would be a master's. No, I have that wrong. Critical care would be a master's. Right. And then it would be a mid-level provider for community paramedics. Okay. And I think that would take a big strain off of the hospitals. Yeah. And off of the doctor's offices if we could just go straight to them. Yeah. And so it would be cool if we had a pathway to go there rather than having to restart school from the beginning. Right.
I think with the higher education that we would have, it would also lead us to have more respect within the community, whether it's with doctors and nurses. We'll get more into that in a little bit, but I definitely think we would be seen as more knowledgeable.
Yeah, and I was also thinking, so about the shortage, you got to think about why there's a shortage too. And I Googled it, what we hear people say, but I thought I would just see what the consensus is on Google. And a lot of it was low pay, burnout, and lack of a work-life balance. But I feel like all of that is the same thing.
I feel like ties into each
other. To pay. Because you have burnout because you work more jobs.
Or you have to pick up overtime.
Yeah. So I feel like if it could fix pay, then it would obviously increase recruitment. But
because I think a lot of people's logic is, why am I going to go to school more to still be paid the same amount?
Right.
But I think over time, if we have this knowledge and education, that people would be willing to pay us more. I think it's kind of hard because it's a difference between private services and county services, so the pay depends on different things.
Yeah.
But I think eventually that the pay would increase because of that.
And there has been proof in other jobs like nursing. It was once a license and to turn a degree they get paid more.
Right.
And then in Australia, theirs actually just recently changed to a bachelor's degree in like 2014,
really?
Which I didn't realize. And their pay is increased, but like you said, nurses get paid by a private hospital, and then in Australia it's like partly socialized, which I'm sure affects pay.
Right.
So I mean, counties are already struggling to pay.
Yeah, because we both work for counties, and it's pretty much our pay is based off the county taxpayer. So there's a lot that goes into what the county has to do for us to be able to get paid more.
Right.
But I do think that higher education could potentially lead to higher wages that reflect our expertise.
Especially if you're a paramedic that works in the hospital, I'm sure they would pay you more.
Yeah.
But that doesn't really help with recruitment.
Yeah.
And EMS.
That is true. Now on the flip side of things, I think that there's some questions that could be posed. One of those being, what happens to the people who are already in EMS that don't have a degree?
So in the webinar, Danny Naiman, he actually said that they would be grandfathered in, so they wouldn't have to do any extra education.
Well, that's good. I think that would kind of be a concern for a lot of people as to, I don't have the time nor the finances to go back to school.
Yeah.
And I think that kind of ties into the topic we had at the beginning, was the length of the school, because it is a short program. Yeah. It doesn't cost nearly as much as going to like a university for a degree.
That's true.
So we're paying a few $1,000s versus $20,000 for a 4-year education.
Yeah, so ways it would help, in my opinion, of course the pay. That's the big thing. If it increases that, then I think people would love to join EMS. Obviously, like a degree, some people consider it more esteemed and more respectful or respectable, I guess.
When you have a degree?
Yeah, and I think it would interest people in EMS that maybe wouldn't have considered it before, since it can like lead you into more higher healthcare jobs.
Right, career opportunities and advancements.
Yeah, so I think that would, and even like people in our class now, they're doing it for patient contacts.
We have people in our class now that are wanting to become doctors or physicians and all sorts of stuff. So
even if they are eventually going to leave EMS, they are working in EMS while they're getting their education.
Right.
So I think that would add some more people.
What do you believe that EMS as a whole's reputation to the public is right now? How do you think we're viewed?
I think overall, I really haven't heard complaints from us. I mean, everyone is always pretty thankful. They thank me for my service sometimes, which I don't know how to respond to that.
I say you too.
But I don't think they're very educated on the requirements to become a paramedic.
I completely agree with you on that.
Especially since some people think we're ambulance drivers.
Very true.
So
yeah. I think we're often misconstrued as ambulance drivers or just some form of transportation for people to and from the hospital. The ambulance service has only been around for 58 years, and it's been considered a use for life-threatening emergencies, and I feel like people have forgotten that that's what it's there for. Not to say, our emergency isn't somebody else's emergency.
Right.
I was talking to my fiance about this, and she was not sure of any of the schooling that we had to go through to get here. So I just think people are, for lack of better terms, uneducated about what EMS really is.
I think so.
Yeah.
But I think if they were educated on the requirements, they would be for having a degree. I think they would agree that would probably be beneficial.
Yeah, I mean, if we're supposed to be taking care of them in life or death situations, I think the more knowledge that we have of situations, the more trusting they would be for us to take care of their loved ones.
I think so too.
Yeah.
Oh, and that kind of something that I'm going to add too. So I feel like we are like our scope of practice is growing, and we need to know more. We're being taught more every year. I was just recently talking with a paramedic who's been in the job for years, and she recently had to retake National Registry, and she said that it feels like we're like basically doctors, which I don't completely agree with, but I get what she's saying. Like, we have to know things more in depth, and I feel like we should have a degree to represent that, to reflect it.
Yeah, I mean, think about doctors and nurses. They have the proper tools and imaging and blood work and all that to come up with diagnosis within a longer time frame, whereas I think our average call time is about 45 minutes for us, so we have 45 minutes from response time to end call of treating, figuring out the problem, and the only kind of imaging that we have is our eyes and a monitor for an EKG. Other than that, everything is all based on knowledge that we have to treat.
So patient presentation.
A lot of it is all in our eyes, and I think the more that we can see, the more that we can think about what's going on.
Yeah, I agree with that.
Yeah, but I think overall a degree in the public's eyes would be a very positive impact.
I remember what I was going to say now. So some say medics would receive better training and improve patient outcomes. So I kind of disagree with the first part in the better training, because an associate's degree would just provide those general education classes. I don't think it would put any more time into what we would learn as paramedics. I think a bachelor's degree would be super beneficial, because I would love to take more time on the subjects we have now, because I feel like, for me personally, it's not enough time for me. So, and that's not a Columbia State thing, that's just the paramedic program in general. It's super fast paced. But whenever it comes to better outcomes for patients, the guy on the webinar, Danny, he also mentioned that there is proof that the general requirements like arts and humanities do improve patient outcome, because it makes you more empathetic, helps your critical thinking skills and stuff.
A lot of our job isn't just treating the medical or the trauma. There's a lot of societal problems that we deal with that I think if we have the knowledge on how to handle those situations, makes us better people and better paramedics in the end.
For sure.
Yeah.
I think we're kind of like mini social workers too.
For sure. I think we're like little therapists.
Patient advocates.
And I think that's what a lot of this job is just doing what's best for your patient.
Yeah.
Now, aside from the public, we work a lot with other healthcare workers. How do you think our reputation is with them now, and how would a degree affect that?
So I think, at least for the emergency department, they have a lot of contact with us, so they know that most of us at least know what we're talking about. So I think they trust us, but I think other people in healthcare that don't come in contact with us probably don't really, I don't want to say don't take us as seriously, but they know that we have less education, which probably plays a factor in how much they would trust our opinions, maybe. So I think the people we work with most, they definitely respect us and trust us, but I think a degree would really help boost our reputation in the healthcare community.
I definitely think that the doctors and nurses that we work with, especially in the emergency room, there's a form of a mutual respect there. But I do think that there's times where I personally have brought patients into the ER where I've been questioned as to why I've done what I've done. It doesn't happen often, but I just feel like they don't sometimes have nearly as much trust, because I think they have a better understanding of the schooling that we go through and understand that it's not a very long program.
And that could delay patient care.
Right.
So,
yeah, absolutely.
And I think like all other healthcare professions require a degree. So why is ours not?
Exactly. I definitely think it would help show our advancement in knowledge and skills that we can possess. And not only that, but it would demonstrate a level of commitment to our profession.
Oh yeah, for sure. Like I saw that you mentioned that making the degree process a little bit longer might, get rid of some people at the beginning, but it would keep people that really care about the profession. That don't mind putting in extra time.
I think You know, as short of the program is, people sometimes look at it as like the easy route to get a career.
Yeah.
And then they just don't try as hard, they don't take it as seriously.
Yeah.
And that's very dangerous for this profession, that we need to be able to take it seriously and recognize the emergencies. And so if we can pick out the people who are truly dedicated and committed to becoming paramedics and constantly advancing their knowledge, I think that would show a great respect between healthcare workers and everything.
I think so too.
Yeah.
So maybe we should highlight how it would possibly hurt the profession or hurt recruitment.
Mm-hmm.
We might have mentioned this earlier, but obviously employers would have to wait a little bit longer.
Mm-hmm.
As I mentioned, it's usually, at least Kansas and Oregon, they've done it with only an extra semester. So I feel like that's really not too bad.
Mm-hmm.
And also, that extra semester could possibly be done online while you're still working.
Right.
So, I mean, obviously the wait time is a little bit longer. And then I also read that there would be a decrease in the qualified programs that could provide the education. So, like, anything that's not connected to a college wouldn't be able to do it.
Yeah.
Like, you know, fire-based services or, like, city or county-based not services, but, like, programs. So it might make education harder to access for some people.
Yeah, I think a lot of it has to do with like finding a balance between accessibility and credibility.
Yeah, and you mentioned before, I think, like extra money, they call it, you know, extra time and extra money.
Yeah.
But there are a lot of like financial aid stuff right now, especially for adults going back, like Tennessee Reconnect.
Yes. Yeah.
You can get an associate's degree for free with that if you don't have one already. So I think those are ways it can hurt, but I think there's also solutions.
You know, as far as the length of the schooling goes, for people that are worried about time and everything, I think one of the benefits of not having a degree was how you're able to kind of break up when you're doing the school, whether you do EMTB and then wait 2 years to do advanced and then 2 years to do paramedic, whereas if you're going back for a degree, or if we're changing it to a degree, it's going to all be one long thing. There's no, I mean, other than Christmas breaks and spring breaks, there's no breaks in between. So I think that would kind of pose some difficulties for people that are wanting to get into
and I
this.
wonder if we would just get rid of EMTs altogether and just go straight to paramedic, or if maybe a EMT certificate could be an option to work while you're going through school.
Yeah. Overall, how do you think this would impact recruitment?
So, as I mentioned before, initially, I think it would have a negative impact. I think once it becomes the new normal, and then when people really consider how much a degree would help them in their future, I think they would consider it. Because, you know, it's only one more semester. We're basically there already.
Yeah.
You know, from basic, advanced, and paramedic, we do 77 credit hours.
So we are there, just missing the general studies.
Yeah, because an associate's is 60.
Yeah.
And then paramedic alone was 41 credit hours, 41. I think. Yeah, so we're basically there.
I definitely think that it would ensure that all EMTs and paramedics have the knowledge and skills for a higher level of care.
Yeah. Yeah, I think the main thing that I think is a benefit, and I don't really know if this would help recruitment necessarily, but just like to support the idea of a degree, is that you can advance if you want to. Because right now, for paramedics, it's like there's really not much room for advancement. You got critical care.
A lot of services require their supervisors and captains to be critical care paramedics.
Yeah.
So kind of falls into the career advancement part of it. And if you're going to be a supervisor on these life or death situations where there's serious injuries, you need to have that knowledge and that pathology and pathophysiology to understand what's going on and how to best treat your patient.
Yeah, I agree. And you know, if you ever wanted to do something else in healthcare, then you know, you don't have to restart. You already have that foundation to build on.
Right.
So on the topic of pay, Oregon apparently started their transition to associates in 2000. So I thought it'd be interesting to look at their pay versus our pay, and then their pay before 2000. So the just median salary for a paramedic in Oregon was $49,000.
Okay, I feel like that's pretty average.
And you know, that's like mid-range.
Right.
So Kansas was only 40,570. So those are two with associate's degrees.
Wow.
And then Tennessee was 49,610, which is
Without
more
a degree.
than the two with a degree.
Now, there's not a guarantee that pay will increase, and I think that's the concern.
Yeah, I agree. I think that is a big concern, and I honestly feel like pay probably wouldn't increase because, like you said, we are county-based, so they would maybe have to raise taxes.
Exactly.
Which I don't think people would be in benefit of.
No.
But, yeah, that'd be something to look into, how to increase our pay. Like, do any grants?
Yeah.
Like, I don't know how that would work exactly. But a way that could possibly help with the, negative impact that it could possibly cause is maybe making it easier for paramedics overseas to work in America. Because they have a bachelor's degree. That doesn't necessarily mean their scope of practice is exactly the same.
Yeah.
But if they found a way to, give them that little bit of extra education or skills practice, rather than like start from the beginning, I think that would help a lot because there are people that want to move to America.
Yeah. So I feel like for paramedics coming overseas that want to be paramedics in America is pretty easy, honestly. We've got different scopes of practices and different protocols for different states for just simply for advanced EMTs.
Yeah, I get that like we have different scopes of practice for everything, so maybe they would just need to, catch them up to par.
Yeah, go over protocols depending on what county or service they're working for.
Yeah, especially if they have experience. It's just a few, like for example, Marcus, he got his degree in Australia, but starting out medics there can't give ketamine and they can't intubate. So luckily he was, it's crazy. But luckily he was able to find a program here in America to like give him that little bit of education. And, he checked off all of his skills and did everything we do to become, paramedics, except it was just extremely fast paced, at least the education part, like all the medical and trauma stuff. But then the hours.
He's still got the anatomy and physiology knowledge of the body and the systems and everything like that.
For sure, because they had full semesters on stuff like that.
Right.
But I think if we can make it easier, then I think that would help a lot.
Yeah, I agree.
So, because there are visas for jobs in America that like need people, and I think that would help a lot if we advertise, hey, we need people in this career path, and we're not going to make it super hard for you. So.
Right. Well, I pretty much stand everywhere that you stand on this topic. I definitely think that there's a high possibility that recruitment and or retention might decrease to begin with. I think a lot of it does have to start with the pay. Like you said, a reason that we lose so many people with this job is because of burnout, and the burnout is due to the lack of pay and having to work multiple jobs and overtime and missing holidays and time with your family. So I think if we can start with the degree, which would slowly, hopefully, fingers crossed, lead to an increased pay, better respect among the community, better respect within healthcare workers, I think eventually we would start to have higher recruitment rates, higher retention rates, and less burnout.
Yeah, I agree. And always a chance to advance your career in the future, I think is a big bonus too.
I agree.
So in conclusion, I think it would really benefit us to have a degree, an associate's degree. I would love for that to happen.
Yeah.
I don't know how realistic it is. It's definitely, if we can do it, it's just if people...
Yeah, there's going to be some things to work out.
Definitely a work in progress.
It's going to be hard to get everyone on board with it because I feel like if it were to be a thing, it would have to be a nationwide thing.
Yeah.
I know there's some states that have done it individually, but I think in order to see some high success from it, it would need to be a nationwide thing.
Yeah.
But I do think that there would definitely be a positive change in the end with it.
I think so too. I agree. All right.
So that is the end of our discussion for today, and we hope you enjoyed.